My name's Toby Green. I'm a professor of African history at King's College in London. As somebody who's been working on the African continent with colleagues in many different African countries for a long time, I was straight away extremely concerned when the coronavirus pandemic began and when the restrictions began to be imposed across the African continent as to what this would mean for daily life. Because I was in contact with people regularly in many different countries who were giving me a picture of what these restrictions meant for daily life. People who would get beaten if they went outside, because if you impose this kind of restriction in poor countries where the infrastructure is weak, it's very hard to police, and it will inevitably lead to an increase in authoritarian forms of government. So it was having that kind of impact, and also it was having a terrible impact on livelihoods, because 85% of economic activity in Africa is in the informal sector. That means people have to travel, have to move, because they're often bringing goods to market, and suddenly that was all stopped. So I knew that this was going to be a disaster. So when I discovered that Collateral Global was there and was going to be taking these kinds of concerns to heart, I really wanted to get involved. It's an enormous task that we have before us. First, my perspective, which is an internationalist one, I'm very concerned about what's happened and what the real impacts have been educationally, in terms of public health, in terms of livelihoods and futures for people in poor countries. But at the same time, I'm very much aware that the evidence base for that is still very fragile. There's a real need to conduct sustained research. And I'm not the right person to do all of that at all, but what I can bring are networks and connections and the training I do have in economic history and data analysis, which therefore will allow me, with colleagues, developing a network in different parts of the world, to look at all that in detail and to try and to begin to put forward both the evidence and some kind of analysis as to what this has meant. When the panic began 2 years ago now, people didn't really take into account the fact that we are global citizens. We do all live in particular locations, but we have many connections, many people do, through work or through family, and our activities have an impact not only where we live, but also increasingly, because of globalization, on a global level. So, for example, let's take travel. If we decide we're going to really stop the tourist sector for a long period of time, this has a devastating impact in poorer countries, among poorer communities who in many ways depend on that sector for livelihoods. And in fact, there's been a lot of research done that it's increasingly, and not exclusively, but a large part of the economic benefit of tourism in a country like South Africa, for example, goes to women and also to poorer members of society. So understanding that this is a global society, a global culture, and therefore when a response which is globalized to an illness takes shape, as has happened, that has a global impact. It's something that we really have to get across, and we can do that through data, and I think we do need to accumulate more evidence and more analysis of that, but we also need to accumulate stories. I think we really need to accumulate the voices of people who haven't been heard. So in Angola, a country where, according to the National Statistics Agency, half of the households are overcrowded, children weren't allowed out for 7 months. They weren't allowed out of their homes for 7 months in Angola. Now we can try and begin to imagine what that might mean. I mean, already, in the countries like, the UK or the US, we know that people don't always live in good accommodation. They might live in crowded accommodation. But if we take that to a situation where they may not have electricity, they may not have running water, they may be living quite a long way from anywhere where they can get a reliable source of food, it's really an appalling crime is the only word you can use to think about what that actually meant for both at the time and of course what it will mean in the future for those young people, and what that might mean for future social relations and future political tensions which might arise because of that unbelievable experience which those children had. And there are many other examples that could be given, and something which I found, another example which I think I find disturbing, was also the interview I did with Llanos Ortiz Montero, who was until recently Deputy Director of Doctors Without Borders Spain, and has a career history of working in emergency responses across the African continent in many, many, many countries. In the interview she listed them, and I think it's over a dozen African countries. And she was actually in Sierra Leone in 2014 during the Ebola epidemic there. And one of the things which I think was disturbing was that, in fact, at that time, lockdown policies were trialled, actually, in Sierra Leone for just 3 days. And Médecins Sans Frontières at the time warned against them and said they would be counterproductive. And afterwards, academic studies were done, which showed that they hadn't worked. And yet they were rolled out again. Those are the kinds of stories which really need to reach a broad public so that we understand what this has meant for people. So what are we going to do? What we're going to do is develop offices, regional offices in the different continents around the world. Small offices with regional directors who are closely connected to the issues in their sub-region, and will be able to have a small team working with them to commission new research on the issues and factors which really need investigating. And so with those offices, I think we're going to be looking at 4 or 5 offices around the world with qualified people who've got good experience of this kind of research, then commissioning this kind of research from universities, researchers in their region to show the impacts that matter to them, coming back to the point I made before, the community-based impacts and possibly also community-based solutions which also took place. So with those sub-regional offices, we'll have a real on-the-ground, building upwards sense of what has actually happened.